Well, the holiday season is a time for family, for friends, for fun. It's also the time when we get colds and flu and other illnesses as well. Tonight, we are joined by certified physical assistants, Whitney Crain with Cone Health LeBauer HealthCare at Oak Ridge to talk about how to stay healthy and what to do if a loved one does get sick during the holidays. We're going to start with prevention. What are some top recommendations for how to stay healthy and avoid being sick this time of year?
Yeah, so obviously, most of us know washing hands and covering our coughs, but the question is, do we do them appropriately and effectively? First thing with washing hands, of course, it's a full 20 seconds. And if you're like my children, it's a race to get who to the dinner table first. So sometimes that actual effectiveness of, scrubbing your hands, counting to 20 or singing happy birthday is not done appropriately. That's first and foremost. Second of all is don't cover your cough with your hands. Of course, we cover it with our elbows, because then, of course, the next time you shake someone's hand, you've effectively just passed that virus along. Along with prevention, too, is, of course, vaccination. I hear in the clinic all the time, oh, I don't get the flu shot because it gives you the flu. And of course, that's not correct. A lot of the times, the flu shot, when you might feel symptomatic for 12, maybe 24 hours after getting that vaccine, of course, that's your body starting to create an antibody response, which is, in essence, what we desire and what we are hoping for. Plenty of hydration, rest, these are all very, very important for doing so. And lastly, for prevention is understanding that most viruses do have something called an incubation period, which is the time frame after you've been exposed to the time frame of having symptoms. Many of us, maybe a mom or a dad is sick with the flu, and we send our children to daycare anyways because they are asymptomatic. But unfortunately, we can somehow still spread the flu that way before we are exhibiting symptoms. So keeping in mind thick contacts, close family members that have been ill, trying to prevent that further spread by keeping sick family members at home.
All right, so it always happens. People get sick. So what should we do if someone in the household gets sick so we don't spread it?
Exactly. And that can also depend simply on the symptoms that somebody is having. For instance, most of these viruses are spread via droplets. So the easiest way for it to be passed is if someone is actively sneezing or coughing. Somebody that's sneezing or coughing, of course, you can either have them wear a mask, they can be isolated in a room. If you want to have a family encounter with people, the 6-foot rule is not new, even though we all learned about it because of COVID. Having them spread away from where that potential droplet would affect them is one of those recommendations.
Okay, so inevitably someone's going to get sick and you're going to need some help with that. What options are available during the holidays when someone gets sick and your doctor may or may not be open?
So there's actually a lot of options, particularly through Cone Health, which is where I work. I've done urgent care and virtual care, and these options are available 7 days a week. With urgent care, this is a good opportunity to get that testing done when your doctor is not available. Virtual visits is, in essence, similar to what I'm doing right now. It's a video visit where you speak with a licensed practitioner, and they are also available 8 in the morning till 8 in the evening time, Monday through Sunday, so 7 days a week, including holidays. This is a good option for some of those minor symptoms. Of course, if you're exhibiting serious shortness of breath or chest pain, that would not be appropriate. There's lastly something called e-visits as well. If it's just something that you have a short little answer or question for, a rash, a sniffle, a cough, you can actually submit. It's more of a questionnaire online, and you don't have to talk with anybody directly, and they will usually respond within an hour or two with direct answers to your questions. So really, there's a vast array of different places that you can go.
Okay, and no doubt you're going to have guests. They come from out of town, they get sick. What happens if you have a guest who's from out of town, they're sick? What options do you have to help them find help treatment?
So believe it or not, you don't have to be a Cone Health patient to do the virtual care option. As long as you are physically in the state of North Carolina, we can give you that treatment through both the virtual care and the e-visits. Obviously, a visiting family member is more than welcome to go into any of the urgent cares as well. So I work in the family practice, and we do have an option also for virtual care through your own family doctor. Obviously, those are slightly restricted hours during the normal business hours of your family practice, but that, of course, is an option for a family member as well.
And this is always the debate. Where should you go for care? When should you go to urgent care versus the emergency room?
Believe it or not, urgent care actually is capable of dealing with a lot of different symptoms. Typically, emergency room should really be kept for those that are dealing with emergent issues. If you are having difficulty with breathing or feeling extremely short of breath, chest pain, please, those are appropriate for the emergency room. If you're having a fever that's responding to Tylenol or ibuprofen, some sniffles, a cough, those would be appropriate for the urgent care setting in which we could do diagnostic testing. Also, urgent care does have capability of diagnostic imaging and labs as well. So there's a wide variety of treatments and things we can do for urgent care.
So people may be traveling during the holidays. You may be traveling during the holidays. What measures should we take if we know we're traveling for the holidays and we get sick?
So first and most important, particularly for individuals that have chronic health issues, please make sure that you have plenty of your medication when traveling. I know sometimes we can spill them or accidentally run out, and that can be challenging, particularly when certain offices maybe have different hours for the holidays or even pharmacies to try and fill them. So being proactive, trying to make sure you don't run out of blood pressure or insulin medications would be my first and most important. Also, as far as being proactive, my husband makes fun of me all the time, but I always take a thermometer with me because I like to know, um, is my child actually sick? Are they just playing with me? And taking certain things that you know will be helpful. So, for instance, with my two young ones, I take nasal spray everywhere because, as we know, those respiratory symptoms usually start with runny nose, nasal congestion, sneezing, and sometimes to get rid of it before it starts causing other problems is extremely important.
Gotcha. So being prepared and taking some things along that you know already help when they're not feeling real great. All right. So, but what about if you actually get sick when you're traveling? What should you do if you get sick while you're traveling? What are your options for seeing a doctor when you're so far away from home?
Yes, of course. If you are visiting North Carolina from a different state, like I said earlier, there are options for virtual care and urgent care in which we can certainly provide you with treatment options or screening. A lot of times people are having COVID tests already at home if they're concerned that that is maybe what's going on. If you have a positive test, there's no need to leave your home. You can call through the virtual health and tell us about the positive. We can discuss your treatment options that way. Not only is it safer for other people that maybe aren't sick, but it's more convenient for the patient, and you don't have to leave the comfort of your own home.
You know, at the beginning of all of this, we were talking about ways to help prevent getting sick. Are there additional things that we can do to boost our immunity?
So there are, first and foremost, and this is more of just a general prevention, not even for respiratory illness, is staying healthy throughout the year by trying to exercise, get plenty of sleep, water, water, water. I tell my patients that all the time. For those that are still concerned, however, this has actually been well proven. It's called quercetin. Quercetin is an antioxidant, it's an antiviral, it has immune boosting properties. And this actual example that I showed also has zinc. Zinc has been well proven as well to be very, very helpful. And when taken together, they have synergistic effects, meaning one helps the other, one boosts the effects, and the other helps with the absorption.
Are there foods as well that we should be eating or things like that to help boost our immunity?
Sure, absolutely. So some of the natural ways that you can get quercetin, believe it or not, that's a flavonoid, is found in your dark leafy greens, spinach, kale. Vitamin C is also found naturally in foods such as bell peppers, strawberries, most citrus foods such as orange juice. These are excellent ways. And to be honest, usually our body accepts and digests and absorbs those natural ones better than, say, a multivitamin or a supplement. So eating a well-rounded, healthy diet, as I say, eating the rainbow is the preferred and best way to try and stay healthy.
All right, so she gave us some foods and she gave us a supplement to think about. Now here's the question I want to ask. Are there any myths about immune boosters that you'd want to set straight?
So, of course, everyone knows about vitamin C and elderberry. And what I've heard or what patients have asked me in the past is, what if I take this, all year? What if I take this during cough, cold season? Will I be prevented? And the answer actually is no. There's no proof that taking it prophylactically or before you're sick will prevent a cold. There is some evidence, however, that taking elderberry and vitamin C when you're sick can help shorten the course.
Okay, so we're gonna just kind of like summarize things one more time because I want to get back to prevention because that's what she just said. I know you wanted to get back to prevention one more time before we left this conversation, just about what we can do to prevent getting sick this holiday.
Yes, like we said before, prevention is key for getting sick with that hand washing. That is key point, covering our cough, covering our sneeze. If you do have chronic health conditions, of course, wearing a mask when you're out. Unfortunately, you can't tell a 1-year-old to cover his cough or his sneeze. It happens. So knowing that you're exposed when outside of the house, taking those key preventative measures is very important.
Okay, and so we're wrapping things up. Any final thoughts on getting care during the holidays?
Yeah, the most important is, like I said, if you do have flu or COVID symptoms, remembering that you actually do not need to leave your home. You can submit an e-visit, you can do a virtual care option. If you do a e-visit after 8 p.m., they usually will respond the following day. But again, it is extremely convenient. I personally have used it when I've not wanted to leave the home and wanted to stay snuggled up on the couch.
Great. Thank you so much for your time and your expertise. If you missed any of this, this will be in the To Your Well-Being section of our website.